Hi, my name is Tony Watt. I'm a mental health clinician from the Mount Sinai Hospital Wellness Center. My work involves treating seniors with mental health issues and emotional problems. And I also see some of their caregivers. As you may know, caregivers that have to take care of seniors may have to deal with a lot of complicated issues. For example, they may have more medical problems, emotional problems, family dynamics, or they may have specific illnesses like dementia, Parkinson's, things like that. Because of these complicated situations, caregivers undergo quite a bit of stress, and this stress can also lead to feelings of anxiety. So today what I'm going to talk to you about is caregiver stress and anxiety. Today I'm going to talk about caregiver stress and anxiety. First, I'm going to describe a typical caregiver case. Although this caregiver case is fictional, it's made up, it's going to reflect a lot of caregiver cases because they're often very similar. Second, I'm going to tell you about the warning signs for anxiety. And lastly, I'm going to talk about what you can do about anxiety. So in this case, we're going to talk about May, who is a 48-year-old mother. She has two children who are in high school. Although her husband and her work, she also has to take care of her 74-year-old mother who lives in a senior's residence. Since about 3 years ago, when her father died, her mom has become more and more dependent on May. In the past 3 years, May has also noticed that her mom has gone through a lot of changes. May has started to have a lot of worries. She worries that her mom won't remember to take her medication, to turn off the stove, and sometimes she worries that whether she'll fall again, because this year she's already fallen twice. Before, May could visit her mom once a week. Now it seems like she has to visit at least 3 or 4 times a week. May has to also help her buy groceries every week, and a lot of times has to drive her to specialist appointments. In the past 3 years, May has also noticed that she herself has gone through some changes. Every time her mom calls, it seems like she has this feeling of anxiety right before she picks up. Sometimes she feels guilty when she has to choose taking care of her mom over her children or her husband. And sometimes she really worries if she doesn't pick up that phone, whether just this time, if I don't pick up, something will happen, and then she's going to regret it for the rest of her life. May has also noticed that she's had some physical changes as well. For example, she doesn't sleep as well anymore, and she feels tired all the time. Because of May's grueling schedule, taking care of her family, going to work, and also taking care of her mother, she doesn't have time for exercise, and she hasn't seen her friends in months. And finally, May feels like there's no one to help her take care of her mother. She has a younger sister in Toronto, but every time she calls her sister says she's too busy to help. Okay, after hearing May's story, how do you feel? Does her story sound similar to yours? Next, I'm going to list out some of the warning signs for anxiety. Physically, you may feel you'll have problems sleeping. There's probably a decrease in appetite. You may feel tired. You may have some muscle tension and pain, and also you'll probably get sick more often. Psychologically, you may have memory problems. You may have a decrease in concentration, and you may experience what we call panic attacks. Symptoms of panic attacks are a sudden feeling of intense anxiety. You may find yourself feeling hard to breathe. Your heart may be racing. You may feel like you want to escape or avoid that situation, and your chest may feel very tight or heavy. Emotionally, you may feel anxious a lot of the time. You may also feel excessive guilt, and you may feel increasingly irritable. So what can we do about this? Although there are actually many ways to deal with stress and anxiety, I think if I list out all of them, you probably won't remember all of them. So I thought I would focus on the 3 most important ones. First, research has found a lot of evidence to suggest that the best thing to combat stress and anxiety is exercise. Now, exercise doesn't actually have to be very strenuous. You can do things like yoga, stretching, or even just going to take a walk. If you really can't do these type of exercises, you may want to try relaxation methods. You can try things like abdominal breathing or deep breathing. You can try muscle relaxation techniques, or even trying meditation. The second method is to try and challenge your thoughts and worries to see whether they are accurate or not. I'll give you an example. If you think that your mom is always not taking her medication, well, you can try and find some evidence to back this statement up. Maybe you can take a look at her pill box and find out whether or not she has actually missed taking pills. So if the evidence says that she hasn't taken her pills, then yes, you need to worry about this. But if she has taken all of her pills, then you need to discard this thought. The third thing that you need to keep in mind is that you don't have to do everything yourself. The fact is that you can ask your family members to help out. You know, what I find is that it's more of a communication issue rather than the fact that your family member doesn't want to help. The other thing is also that there are a lot of community resources that you can try as well. For example, you can try doing supportive counseling, or you can attend caregiver support groups. There are also more specific groups that you can attend for example, if your family member has dementia. You can attend a group from the wellness center called the Right and Cares program. As a caregiver, you know how hard it is, how much time and effort you need to devote to this caretaking responsibility. You know, sometimes you feel like no one understands you, and often you don't get appreciated. All this stress can lead to overwhelming sense of anxiety, and this anxiety can affect your physical, emotional, and psychological health. You know, you need to become aware of whether you have symptoms of anxiety in order for you to be able to do something about it. And what you can do about it is to do some exercise, to challenge your thoughts, and to get some support, whether from your family or from the community. Thank you.